All right, legends, welcome back to another video. This week we have Dr. Arun Dhir. Arun has been in the videos in the past. For those of you that don't know who he is, he's a leading bariatric surgeon in Melbourne. He performs the mini gastric bypass procedure. He's a plant-based surgeon. He has written a book on plant-based eating. He's very knowledgeable in this area. It's a big part of his bariatric practice. Apart from bariatric surgery, he advises patients on how to eat well so that they can avoid bariatric surgery. So here's a little snippet from this week's podcast. It'll be posted on Wednesday, but here's a taster. This is a short little segment where he talks about hairy moments in surgery where he's not cut through an artery, but cut through a major vein, which can be more dangerous than cutting through an artery because it's low pressure. And here's what he had to say about that. Have you ever been in a situation where you've cut through a major vessel or something and you've just... Or have you seen it, as a registrar, seen other surgeons do it? And what do you do? Like, that would be just a terrifying moment.
Yeah.
I've seen there's a major vessel that goes up from the inguinal region, the inferior epigastrics, and I don't know if it's a major vessel, but I've certainly seen someone cut through that before, and it was quite an edgy moment.
Yeah. Well, it certainly is, and you're getting me into a tight corner now, Mark, putting me up against the wall. But look, you know what? I think as surgeons in our training, we've all seen and experienced and gone through, these sort of instances and these sort of horrific instances, let's put it this way, and it's a part of maturing process. Surgical maturity comes with making bad judgments and bad decisions, and you learn from that. I can say with confidence and hand on my heart that I haven't lost a patient, but yes, we have had complications. We've had issues where, we damaged a very major vessel at the time of surgical dissection when we were trying to carve out this very stuck tumor, which was in this part of the bowel called the duodenum. So duodenum is something that, attaches to the stomach. So that's the first part or the topmost part of the small bowel that attaches to the stomach. And it was in the third part of the duodenum where this tumor was stuck, and we were trying to shave it off one of the major vessels in that area. And there was a damage to the wall. And, in many ways, if you were to have a damage, you would rather have damage to an artery than a vein. And the reason for that is arteries, as you probably might know, are thick-walled, and they have got blood flowing in high pressure. So you can see the blood spurting out. So you can actually see it, put your finger on it, and take a stitch. But when there is damage to the vein, which is a low-pressure system, and it's taking all the blood back to the heart, the blood just oozes. It just keeps oozing out. You just have to, it's a challenge to have to fix a bleeding from a vein, a large vein. And that was the biggest thing, for us at that point in time.
And I mean, I've seen these situations, and as someone who has observed it firsthand, when you've got a pool of blood, trying to find a leak underneath that pool of blood, trying to swipe aside the pool of blood and then to find the leak is a very difficult thing to do.
It is indeed. And that's where various techniques of actually putting pressure on that area, trying to kind of get a handle, get adequate lighting, and, the various things that have to go. And most importantly, keeping your calm. Because the thing is, if you're really stressed out, you are kind of in a reactive mode, you can take wrong decisions. And, which is where one of the first things that we were told, and this is back in the days of open surgery, when when laparoscopic surgery wasn't that advanced, the teaching was that, put some pressure, go into the tea room, have a cup of tea, or relax first.
What?
Yeah,
really?
This sounds very counterintuitive. And now if you translate that, there's a very interesting sort of, a hilarious bit of, snippet here that I can share with you and your audiences that, very recently or not that long ago, I was observing a surgeon who was being mentored by a senior surgeon in a particular procedure. And suddenly there was this bleeding, that started to happen. So the senior surgeon who was mentoring the junior surgeon, and I was just observing, I wasn't even scrubbed, he said, this senior surgeon was observing this junior surgeon trying to kind of, fix it, do this, do that in a very kind of jittery fashion. So the senior surgeon said, do you mind if I just take over now? And I'll tell you what we should do. So all he did was took 2 packs and put it over there, got the assistant to put a nice pressure, cleaned up everything, and I said, let's go for a coffee. All right. Now, this might sound very counterintuitive, but
What were you thinking?
I was thinking that, well, it's probably not a bad idea because you give the anesthetist a chance to catch up, give the fluids to the patient, and there's no bleeding that's happening because you've put pressure on that area from where the bleeding was coming, So essentially, they came back, they slowly removed those gauze pieces which were there. The bleeding had significantly reduced. And again, now this is an assessment that you have to make at the time, depending on how extreme the bleeding is, So the bleeding and they could see, more importantly, where the bleeding was coming from, and they could put a stitch and control that bleeding.
But I suppose during the coffee, he sat there and he would have said,
Yeah. So
calm down. Just chill, take a breather. Because this is what this is all about, teaching young surgeons.
Exactly, and interesting you mentioned that. He had one coffee and he said, let's go to the senior surgeon. Let's go and quickly find out. He said, no, wait, this is a 2 cappuccino bleed. So, have another coffee,
What a legend.
Yes.
I'm going to ask who this was later.
This
guy's gone up 10 levels in my book.
Oh my God, So it was a 2 cappuccino bleed.
That is so good. That is so good. Yeah, so he's a super interesting guy. We'll have that podcast posted on Wednesday, and we'll also have the audio on iTunes and whatnot if you just want to listen to the podcast. I'll be away all this week in Sydney, so I might do a little vlog from Sydney, and I'll probably see you guys in the next video after Wednesday on Friday. So see you then.
What does a monkey say? That's right! It's a monkey! High five! Yeah!
That's so funny, isn't it?